hear me okay here? I don't know, it's kind of standing down here. Hopefully it's good enough. So thank you for that introduction, Dr. Till. So yes, I'm a naturopathic doctor, and I really think today has been a really great event for everybody, because it's the model I like to see in healthcare when we have patient-centered care, patients becoming informed, empowered, having a lot of resources of many different healthcare practitioners or providers or therapists that can help them make decisions for their own individual health. You'll know amongst yourself, and you hear here today that it's not a one-size-fits-all type of treatment plan or protocol. People respond uniquely and individually, and they might try all the conventional treatments and still have some limitations and some challenges with their health concern, with their pain. And so it's really good to be looking at all the other options that you might have available to make decisions and choices on your health care that are best suited towards you and your values. We heard a lot today from a psychologist and our holistic nutritionist at the beginning of the day. I'm playing the role of a naturopathic doctor here, and I do acupuncture as well. It's part of our naturopathic medicine training, so I'll talk briefly a little bit about acupuncture. How many people are familiar with what a naturopathic doctor is and what they do? Just raise your hand. Okay, so that's great. Obviously it's a group that are looking for other healthcare options to support them along the way. So we play a nice role kind of integrating conventional standard of care medicine along with complementary and alternative medicines. Naturopathic doctors are medically trained, and we're experts in natural medicine when it comes to that. We all are required, like any healthcare provider or primary care practitioner, we're required to have a pre-medical degree, and then we have 4 years of naturopathic medical training, learning the basic medical sciences, the clinical sciences, the pathology, the pharmacology, the laboratory diagnosis, etc. And then we have 1,200 hours of clinical training, really trying to focus on the why of the conditions versus just this is what it is, this is what you do. We are expected to write North American board exams, and any licensed province or state all have the same level of standards, same exams, and within the provincial bodies you have additional requirements to complete as well. So, similar like you'd expect from many of your healthcare providers, you're going to go through in-depth history on your concerns, exactly how endometriosis or how your pelvic pain presents for you, because there is some differences and variabilities between that in terms of when you notice your pain's worse versus times when it's less significant. We're going through all the supplements and medications you're on, a review of systems, blood work, imaging. All naturopathic doctors are trained in these core modalities: clinical nutrition, botanical herbal medicine, Chinese medicine, and acupuncture. Most Canadian naturopathic doctors have an additional exam in Chinese medicine and acupuncture that they are required to write, but not all naturopathic doctors do that. Homeopathy, hydrotherapy, lifestyle counseling, and naturopathic manipulation. So whole person care, we're not just looking at your walking piece of endometrial tissue or a walking pelvis. There's a whole person to you. So your endometrial tissue is part of the bigger whole, where there is dietary nutritional factors, there's your immune system, your inflammatory systems, your hormones, how they're playing a role, and it might not just be estrogen and progesterone that are playing a role. It might be related to stress hormones as well, having an effect on your body, as well as genetic and environmental exposures. So as naturopathic doctors, we like to take a microscope and look into all the unique factors that are making up you as a whole person. And then when we try to devise a plan, we're trying to base the emphasis of what we're recommending based on what your most significant picture looks like. So naturopathically speaking, we still agree with everybody else here. Hormones and inflammation are two big factors in the process of chronic pain and endometriosis. Within that hormone piece, we're looking at what are other environmental hormone disruptors. We think of phthalates, we think of pesticides, some BPAs and phthalates. They have a role in the body that if you get exposed to them, they can have hormone mimicking properties or disrupt the way the normal chemistry works. So we are mindful of this, and we look at what are the hormones that your body is naturally producing on a month-to-month basis, And how does your body clear or eliminate that in a safe way? It can do so in a way that makes these estrogen breakdown products or estrogen metabolites be a little bit more proliferative, a little bit more inflammatory. And if those are the pathways you're breaking your hormone products down in, they're going to be predisposing you to having more significant symptoms. Genetics play a role. We hear about epigenetics or nutrigenomics, the way things in our environment and our diet and our lifestyle and our nutrition play a role in affecting our genetic makeup. So that plays a role in how we eliminate certain things out of our body, certain hormone and inflammatory molecules in our body. You know, you heard already today about the mental and emotional stress piece, your perceived perception of pain, and how that plays a big role. From an inflammatory standpoint too, you know, diet and nutrition plays a role in inflammation, oxidative stress, so anything that's going to be damaging, whether it's, you know, cigarette smoking or it's maybe eating some fried burgers or deep fried fries from the fast food restaurant, things that might have what we call free radicals, or things that will add a burden to the body. They do a little bit of damage. It's not like your body can't compensate and get over it. It can, but you need to support that. And if you have a lot more oxidative stress than the things that help to heal that damage, it's going to generate more inflammation. Weight issues also become a role. The more weight you have on you, the more fat cells you have, the more internal estrogens that are going to be available as well. Some of the estrogens that are more inflammatory, like estradiol. So this is an overwhelming slide that I really shouldn't be showing on a warm afternoon like this. But really what it is, just to highlight again what you've heard from you know, people prior to myself, that it's complicated. You know, we're talking about estrogens, which is this bottom right-hand piece. And you'll see it's not just like one big estrogen that we're dealing with. There's different types of estrogens. There's an estrone, estradiol, there's estriol. So E1, E2, E3, and then these little circles here are different ways that those estrogens break down. Some of them are going to be more harmful, more inflammatory, more proliferative, so they'll allow endometrial tissue to grow more than others. And you'll see in these boxes all around here, these are dietary, lifestyle, medications, things that will interfere in the way your estrogens are breaking down and having an effect on what type of estrogen. Is it going to be a healthier type of breakdown product, or is it going to be one that promotes more inflammation related to that? So you heard, you know, this morning some really good dietary nutritional advice from the holistic nutritionist. You know, she talked about cruciferous vegetables, about berries. So those promote a healthy breakdown of some of the estrogens. Ground flax seeds in here. This looks like caffeine. Yeah. Rosemary, you know, exercise, thyroid function. So these will play a role in if it's broken down in a positive sense, which is this one. If it's more sugars and refined carbohydrates that are producing insulin, those can also shift the type of estrogens to be this more 16-hydroxy estrogen. So that's really complicated. I should probably stop while I'm ahead here. But hopefully it gets to the gist that it's really complicated. And when we look at dietary and lifestyle influences, it all plays a role. So things kind of based on some of that, avoiding some caffeine. So the coffee and caffeine is a little bit controversial because it could go either way. But I will find if there's certain patients that have a lot of chronic pain, endometriosis, painful periods, and they do drink a lot of coffee, I'll have them eliminate it for a period of time and just see how does that change things. Because for some patients, they'll know right away, like, I had more coffee, I had more alcohol this month, and they know that they're going to be in trouble because that will influence it. You know, insulin, sugar, carbohydrates, you know, are easy converted grain products are going to increase inflammation, as with grain-fed red meats. Food allergens and sensitivities I put up here, we talked about IBS and bowel pain related to endometriosis and chronic pelvic pain. If there are inflammatory reactions to foods, it's going to add to the already inflamed body that's there, that peritoneal cavity, the pelvic cavity, and probably going to aggravate to some degree some of the pelvic pain. Clearing estrogens really well with fiber. Turmeric, I like. It's that yellow anti-inflammatory spice that you see in curries. Cruciferous vegetables. We talked about the kale, broccoli, cabbage, Brussels sprouts, helping to break down healthy estrogens in the body. Green tea can also help with this. Healthy fats are also important. So lifestyle tips. again, some of the things you already heard about today, but maybe thinking about, do I, have a lot of exposure to phthalates or parabens? Are they in my cosmetic or household products, and am I getting exposed to that? Because you might just genetically be one of those people who don't clear them well in your body, and that might be having more of an effect. I mean, it's still really limited research in this area, more related to different associations, but something to consider. So acupuncture briefly and chronic pelvic pain. My patient population, if they have serious pelvic pain, I usually have them come in on a weekly basis. In some cases where it's more significant, it will be twice a week. It can be done up to 3 times a week or more. And it can help with a lot of the other factors that come along with chronic pelvic pain. Research is kind of limited. Some says it, is supportive. Other research says it's not. Really, I think it works best when it's individualized to the patient picture. This was a 2015 study that looked at electroacupuncture. So they're using acupuncture needles, and then they're putting these little electrodes onto them to create a bit of a current to stim a greater response at the acupuncture point. And they compared it to a conventional treatment to see if it had any effects in reducing the pelvic pain. So basically, the conventional treatment as well as electroacupuncture had similar clinical efficacy. The reoccurrence rate, though, at 1 year was lower in the electroacupuncture group than the Western medication group. So again, some evidence to support that it might be something that works for you if you haven't explored that option. Some general nutrients here are, fish oils, anti-inflammatory fats, whether it is through a clean fish source or a supplement. Probiotics, I always think about. The good bacteria in the gut will always help to clear out the estrogens in a helpful way and stop you from recycling them back into your body. So without getting too complicated, it just keeps those estrogens bound up in the stool, keeps them happy, and eliminated out that way. B vitamins play a role in how estrogens are broken down. Magnesium I'll use if there's a lot of cramping, dysmenorrhea, pain, and some patients will respond well. Those will be the patients who already have tension, headaches, or their shoulders are up at their ear, they're stressed. You'll find if you relax everything, you'll relax that uterine muscle tissue too, and it might be less pain that you experience. Vitamin C and vitamin E are basic antioxidants, and it was interesting to see this study to show that it had some significant effect in humans, giving a high dose of vitamin E and vitamin C 8 weeks before scheduled surgery for removing endometrial tissue. So this, in this treatment group, there was a 43% reduction in chronic pain, and in the same group, reduction in pain with sex and pain with menstruation. Botanical supports, these top 3 really have to do with the dysmenorrhea type of pain. The research that I'll be talking about. These bottom ones are more general inflammation and decreasing pain overall. The other ones I'll briefly talk about is melatonin and acetylcysteine. So kind of going through things quickly, but giving you some interesting information of things that are starting to be researched a bit more. So ginger, we think about ginger, in this paper it was primary dysmenorrhea, but I'll still sometimes use it in dysmenorrhea related to endometriosis. They compared, had patients who started ginger extracts 2 days before their menstrual period and took it for 3 days during the start of their menses, and then a group that just took it right when their period started for 3 days, and then there was a placebo group. And so the group that responded best was a group that started taking ginger extracts 2 days before their menstrual period. They had a stronger decrease in pain, but also the big thing here is the duration in pain decreased quite a bit. So instead of it being a longer period of really intense pain, it's much shorter. This other research has ginger and watching to see how it works against other groups of individuals who take ibuprofen or methylenic acid, anti-inflammatories. Women in the ginger group had about the same degree in pain reduction as those who took the medications. If you're a person who doesn't respond well, or you have GI upset or ulcerations and you don't do so well with some of these NSAIDs, you might want to think about using ginger as an alternative option. There were more women in the ginger group that actually became completely pain-free. Valerian, it's a kind of a smelly herb if you have it in a tea, so it's not nice to drink in a tea, but in a capsule. There has been some research. This is a randomized double-blinded placebo-controlled trial looking at patients with dysmenorrhea and finding there was a significant reduction in the group that used valerian. Fenugreek is another herb, so I'll be quick here. Used in the first few days of menstruation, also decreased pain severity. Patients who used it had a decrease in average number of sedating pain medications that they used. Turmeric, again, that yellow spice, there's a lot of research on turmeric. The main constituent in turmeric is called curcumin, and curcumin has a lot of research of different levels and qualities, looking at how it affects all these variables. So the inflammatory cytokines are the things that can generate a lot of pain, the growth factors, so things that will cause proliferation, even some of the blood vessel growth, the angiogenesis that can go towards tissue and support its continual growth. There's not a lot of human clinical trials with turmeric yet on endometriosis. On other inflammatory conditions, there is. Generally, it's safe, so to speak. So I will have patients try it out, in a supplement form, or try some turmeric tea lattes, things that will be supportive to help get a significant dose that can be anti-inflammatory. Pine bark has been used in a trial here, and they combined a study with women who were scheduled to, they were surgically diagnosed with endometriosis, and then they were started on treatment, either Lupron or pycnogenol, which is an extract of pine bark. And they followed them for 48 weeks in total. Every 4 weeks they were checking in on them to see how they responded. Generally within 4 weeks of the pycnogenol, the pine bark extract group, there was a reduction in symptoms. They still had regular menses and normal estrogen levels. So if fertility was an issue for them, they were able to keep fertile and become pregnant. There was a greater reduction in symptoms with the Lupron, as to be expected, because it's quite an aggressive medication, but there's some side effects that are limiting with that one. So it goes to show that there can be some benefits significantly with some natural agents. Melatonin, another really good trial. Basically, patients were either on a placebo group or a melatonin group using 10 milligrams for 8 weeks. And they found that there was a significant reduction in pain scores and dysmenorrhea, and also a significant reduction in pain medication use. So something you might think of, especially if you have trouble sleeping already, adding melatonin into the picture. And then the last kind of nutrient I'm going to talk about is N-acetylcysteine. So this is kind of a lot on this slide, but generally it was an observational study with patients who had confirmed endometriomas, and they were scheduled for a laparoscopic procedure to eliminate that. There was an untreated group, or there was half the people on the waiting list that chose to do the N-acetylcysteine group. And those who did the N-acetylcysteine, 600 milligrams 3 times a day, had a decrease in their pain symptoms, decrease in cyst size. 24 out of 47 actually canceled their scheduled laparoscopy due to decrease in these symptoms and pain. 8 had a complete disappearance in their pain, 21 had a pain reduction, 1 became pregnant in the treatment group. In the control group, only 1 patient canceled their surgery. So there were multiple endometriomas looked at in this study. Some patients had more than 1, but they found that in the treated group, 4 had actually disappeared. So it's still limited. These trials aren't as high quality as we want to see them, but it gives us some indication that there is some research out there that shows it might be of benefit. They actually compared in this paper that these results were similar to a randomized placebo-controlled trial of women who used 4 months of oral contraceptives to manage their pain and symptoms. So really kind of neat. So I'm going to just wrap this up. I have some references of some of the stuff I talked about here, but generally speaking, I'm going to just leave my contact information up here, and if you wish to get in contact with me after the talk today, you're welcome to. Okay, thanks for listening to your attention.